All right, today I'm just going to ask you a few questions about tobacco use. Do you use tobacco products?
Yes.
Okay, what kind do you use?
I use a vape.
Okay, and for how long have you, when did you start vaping?
Freshman year of high school.
Okay.
So a while
It's
ago.
been a little while. And how often do you do it throughout the day?
Right now I do it quite a bit,
Okay.
all day long.
Okay. Yeah, no judgment. I do want to go over just some risks that are involved with it, and I'm sure some of them you probably already know, and maybe some will be new for you. But systemically, it can affect your lungs. I'm sure you've heard that before, and it can put you at risk for lung cancer. And I think a lot of people are surprised to know this, but being in the dental field, there is a lot of risks orally that can come with even just vaping. And that's also the increased risk of oral cancer. And along with your increased risk for gum disease and tooth loss. So it just puts you more at risk for those things. Not to mention, if you do have people that you're around when you smoke it, they can also be affected by it. Maybe not to the same extent that you are, but it does affect people around you as well. So just something to consider. At this time, are you willing to quit?
I'm not looking to quit right now.
Yeah. Again, no judgment. Just want to go through just to get you thinking for when you maybe are ready to quit at some point, just to kind of get you thinking about just the risks that come in even just like the benefits that would come with quitting when you do feel ready. So just a few things, we can kind of go through this, but what are some reasons, like personally, that important to you that would be a benefit of quitting when you think about this would be a reason why I'd want to quit?
I would say probably my lung capacity, breathing.
Yeah.
My lung health. I like sports. I like to be active. So the effect that it can have on doing things like soccer.
Yeah, absolutely.
I would say probably, cancer. And then, I think, if my dentist were to say, man, there's a lot of extra whatever on my teeth, that would,
Get you thinking that maybe I'd want to stop.
It'd be a reason to stop.
Yeah, for sure. What are some negative consequences that could happen if you decided to not quit?
Some of the negative consequences that could happen. Well, like you were saying, cancer. I'm sure it opens up. I actually know that nicotine slows my healing process throughout my body, so I'm not going to recover as easily.
Yep.
Which isn't cool. But trouble breathing. Things like that. I mean, just being addicted to it.
Yeah. Yep.
The addiction of it.
Knowing that, that addiction for sure. Okay. Just move on to this part. Let's look at like some of the benefits that you think. Obviously, we kind of are repeating this a little bit, but I guess I could go over some that would be benefits. Even ones that you don't think of usually is just like saving money. A lot of people don't think about that, and you said how it does slow down your immune system, so you wouldn't get sick as easier. Your blood pressure goes down. It actually affects your skin, so it helps your skin look healthier. And it can affect your taste. A lot of people say that things taste better once they quit smoking. So here's just a whole list, and I will give this to you at the end, but I know some of it's a little different with vaping. I don't know if like smell is really a thing as it would be with like cigarette smoke, but for sure your risk of cancer and with your lungs and all those things will go down, and protecting even your friends from the secondhand dangers of it. So those are some, sometimes just knowing the benefits, that's like a really good encouragement for people to keep looking back on when they are trying to quit. But obviously, I know you've quit in the past, so you know some barriers that come with it, and it's good to know those ahead of time so that you can kind of prepare for them. Are there certain barriers or like triggers that you have that get you to go back to smoking?
Well, when I drink,
Mm-hmm.
I like to have nicotine.
Yeah.
I would say if it's weird, like right after I eat, I like to, but I don't know if that's a trigger. You know, you gotta eat. But I would say stress, and I would say probably while I'm playing video games, I like to do it a lot too. Like in between every round, I like to. It's like so I reach for it, or like if it's far away, I'm thinking about it.
Right.
You know
Yep.
what I mean?
And that's common. You're not the only person that certain, like activities will bring on the time that they want to smoke. For some people, certain places they smoke more. When they're around friends that smoke, they'll do that.
Oh, yeah, true.
Even smelling it for some people, if you're around a friend who's vaping, and then I don't know if that's the same for you, but and yeah, even like you said, stress. Did you say stress? You did say that. There's certain emotions that will bring on that addiction more, where it's like a comfort. So knowing those triggers, you can do things to avoid it, like not go to certain places, or I know it's hard, but sometimes like not playing video games to help you for that time you're trying to quit. Otherwise, just finding other things in replacement. Like, I don't know if like if you have it in your hand and you're used to having it in your hand, maybe finding something else that you can kind of hold while you're doing video games, or I guess you need your hands for video games, but you know what I mean.
Yeah, something to tinker with.
Yeah, yep. But there are resources available to you. I have it on the back here. Websites these are really great resources to just kind of give you ideas of how to quit when you're ready. Even apps, which I feel like that's more our day and age. I have phone numbers if you'd want to talk to someone. And then lastly, there are medications that have nicotine, because that is what you have in your vape, that you can take as you're trying to wean yourself off of it. So it's not such a shock to your body, and it helps with that, that process. So just here's some ideas. If you ever were thinking about doing it and wanted a little extra help on your way to do it. But this is something I will probably just bring up, gently touch on every time you come in. Again, it's up to you when you're ready to do it, but just know that there's no judgment here, and that I'm always a resource for you for when you do want to quit, and I'm here to support you. So, do you have any questions?
No.
Okay. Awesome. So I will give you this, and if you do, you know where to find me.
Awesome.